So I'll be looking at Addison's disease, and looking at this Addison's disease will basically be answering an exam question. Okay, so this exam question, the students were asked to write short notes on Addison's disease. So when you're asked to write a short note, I don't really know the size of the answer booklet in your institution, but at least you should cover like a 1.5. Okay, that's what short notes implies. If it is long notes, then you should be actually trying to cover like 4 pages. Okay, so Addison's disease, we'll be looking at the description and be looking at the clinical features and the biochemical features, right? Biochemical findings for this disease condition. And what is Addison's disease from this image? If you actually to use this image to just describe Addison's disease, you say that Addison's disease is a condition where the adrenal glands are not producing sufficient steroid hormones. Okay, so you could be having adrenal crisis like what? Fever, syncope, convulsion, hypoglycemia, hyponatremia, severe vomiting, and diarrhea. Okay, and on the skin, you'll be having hyperpigmentation. There'll be low blood pressure, there'll be weakness, there'll be weight loss. In the gastrointestinal tract, there'll be nausea, there'll be diarrhea, there'll be vomiting, there'll be constipation and abdominal pain. Then on the skin, there'll be what? Vitiligo, okay, like patches. Right. So now let's look at it. We said that Addison's disease is caused by what? Bilateral. Okay. Bilateral, that means it is affecting the both adrenal glands. Okay. So there's what? Bilateral destruction of all the zones of the adrenal cortex. Okay. And this is usually as a result of what? Autoimmune process. Most of the times it could be that your immune system are kind of like fighting the body's own cells. Okay. So what are the clinical features now? There will be lack of cortisols. All right. And the symptoms for lack of cortisols could include what? Tiredness, weakness, lethargy, gastrointestinal tract symptoms like hair, nausea, diarrhea, vomiting, constipation, abdominal pain. There will be weight loss. There will be hypoglycemia. There will be depression. Okay. Then there will be also lack of what? Aldosterone. So this lack of aldosterone include what? Hypoglycemia, and in some patients they might be craving for salt. Okay, that's for lack of aldosterone. All right. So what are the symptoms? There'll be fatigue, lethargy. All right. There'll be low mood. That's depression or irritability. There'll be weight loss, and there'll be what? Muscle weakness. All right. So also there'll be lack of body hairs, mainly in women. All right. So what are the biochemical features or biochemical findings? If you take a sample of a patient that has Addison's disease, all right, the possible result could be that there'll be decreased sodium levels, there'll be increased um, potassium levels, okay, and there'll be what? Mild metabolic acidosis. And this mild metabolic acidosis is due to what? Decrease in the plasma, bicarbonate, urea, and creatinine. You should note that in this there is diarrhea. So as you are passing out watery stools, you are losing a lot of what? Bicarbonate. Okay. So now acid will be built up. Okay. That's why we say there's mild metabolic acidosis. All right. And there will be fasting hypoglycemia. What is hypoglycemia? Reduction in the levels of glucose in the body. So generally, you are passing out watery stools, you are losing fluid. Do you understand? You are losing nutrients. Do you understand? You are losing glucose, so you'll be weak. So there will be hypoglycemia. All right. So this is just how you reason these things in scenarios of MCQs. All right. That's it, guys, about Addison's disease. Basically, talking about definition, clinical features, and biochemical features. That's it. Bye for now.